আমরা শুরু করব। হোমিওপ্যাথিক পরিষদের পক্ষ থেকে অনলাইন উচ্চ প্রশিক্ষণ পরিচালনা করছি। আমরা বিভিন্ন জনগুরুত্বপূর্ণ বিষয়, পাশাপাশি হোমিওপ্যাথদের আমরা এগুলো নিয়ে ধারাবাহিকভাবে আলোচনা করি। আমরা আজকে আমাদের প্রিয় শিক্ষক ডাক্তার শেখ ফারুকুল্লাহ স্যার, সম্মানিত সভাপতি বাংলাদেশ হোমিওপ্যাথিক পরিষদের, তিনি বিষয় নির্ধারণ করেছেন ডায়াবেটিস মেলাইটাস। এই বিষয়ের উপরে আজকে ইংরেজি ভাষণের প্রথম পর্বের আলোচনা অনুষ্ঠিত হবে। সবার জ্ঞাতার্থে বলছি, আপনারা যারা উপস্থিত আছেন, যদি ক্লাসে উপস্থিত সংখ্যা বেশি ক্রস করে যায়, তারপরে আপনারা যদি ক্লাসে যুক্ত হতে কোনো ধরনের কোনো অসুবিধা বোধ করেন, সরাসরি বাংলাদেশের ফেসবুক পেজে তারা এই ক্লাসটি লাইভ টেলিকাস্ট সেটি আপনারা দেখতে পারবেন। এছাড়াও যদি কোনো প্রশ্ন বা মন্তব্য থাকে, আপনারা সেই বাংলাতে আপনারা বা মন্তব্য করতে পারবেন। তো আমি খুব বেশি কথা, আচ্ছা এখন শুনতে পারবেন?
জি, শোনা যাচ্ছে। হ্যাঁ, ঠিক আছে।
শুনতে পাচ্ছেন?
হ্যাঁ, ঠিক আছে।
জি জি, নেটওয়ার্কের দুর্বলতার কারণে হয়তো এমনটা হচ্ছে। জি জি, আমি সরাসরি কথা না বাড়িয়ে সরাসরি আলোচনায় আমন্ত্রণ জানাচ্ছি বাংলাদেশ হোমিওপ্যাথিক পরিষদের সম্মানিত সভাপতি ডাক্তার শেখ ফারুকুল্লাহ স্যারকে আজকের বিষয়ে আলোচনা শুরু করার জন্য। স্যার প্লিজ।
ওকে, থ্যাংক ইউ ডক্টর পাটোয়ারি। Bismillahirrahmanirrahim. Honored viewers, my homeopathic colleagues, students, and well-wisher of homeopathy. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening and adab. Today we are going to present a very important topic. Every physician, maybe he's homeopath or allopath or Ayurvedic Unani, he will face this case in many patients, and he will have to deal with this patient very well. So this is diabetes mellitus, homeopathic approach. Let us discuss some anatomy for diabetes. You see, this is a picture showing liver. This is liver. Left lobe and right lobe. So there are two ducts coming from liver. This is left hepatic duct from the left lobe. This is right hepatic duct from the right lobe of liver. They unite together, form common hepatic duct. This is common hepatic duct. This common hepatic duct goes below to meet cystic duct coming from gallbladder. This is gallbladder, and it has a duct. This is called cystic duct. Common hepatic duct. This is called common bile duct. In brief, we say CBD, common bile duct. This common bile duct again goes below to meet with another duct coming from pancreas. This is pancreas. And pancreas has so much secretion. This secretion comes through this duct, and this pancreatic duct duodenum. This is duodenum. Juice, they are juices. Next we see, this is another picture showing the whole pancreas. You see, this is like tongue, like our tongue, this pancreas. In the left side of pancreas, there is spleen. And on the right side, there is duodenum, a part of small intestine. So it is sandwiched between spleen and duodenum. And it lies transversely in the abdomen, not longitudinally, transversely, just behind our stomach. So this is the pancreas. And you see, pancreas has so much secretion coming through this duct. This is called pancreatic duct. You see, this is pancreatic duct. This is pancreatic duct. And this combines with this common bile duct and opens into duodenum. Okay. Here we see the microscopic structure of pancreas. You know, pancreas is a combined gland, a combination of exocrine gland and endocrine gland. It is a mixed gland. It is a mixed gland. We know in our body there are endocrine gland only. Say for example, thyroid gland. This is only endocrine gland. Then parathyroid gland. This is only endocrine gland. Then pituitary gland, only endocrine gland. And there are other organs of secretion. Only exocrine. Only exocrine means, what is endocrine and what is exocrine? Endocrine means the gland which secretes its juice or secretion directly into the blood. There is no duct. This is called ductless gland. Endocrine gland is ductless gland. It has no duct. It secretes its fluid or juice directly into the blood. And the exocrine gland, they secrete their juice or product into a duct. This duct comes and opens into some say intestine or somewhere. So exocrine means ducted gland, and exocrine means ducted gland, and endocrine means ductless gland. And pancreas is a mixed gland. It has both endocrine gland and exocrine gland. We'll see afterwards. So you saw the pancreas before. This is so big gland. Only 1 to 2% of the gland is endocrine, and 98% of the gland is exocrine. You see. So exocrine gland or exocrine part of pancreas secretes digestive juices. Digestive juices, we'll see afterwards. And endocrine parts, only 1 to 2 parts. Some cells are distributed here and there, small cells, and all together combine only 1% to 2% of the whole pancreas. They secrete some hormone, and one of the chief hormone is insulin. So you see, this is a small endocrine gland in the pancreas. In whole pancreas, there are about 1 million of these small glands, 1 million distributed all over the gland. And this gland has 3 types of cells. The most number of cells are called beta cells. This, you see, this one. These green cells are beta cells. Beta cells produce insulin. And there are some cells, these black cells. These are called alpha cells. They secrete another hormone. This is called glucagon. And there is another cell. You can see this brown cell. This is called delta cell. Delta cell secrete some other hormone like somatostatin. So we find the endocrine portion of the pancreas has so many small glands all over the pancreas. And each gland, this small gland, consists of 3 types of cells. Alpha cell secreting glucagon, beta cell secreting insulin, and delta cell secreting somatostatin and other hormones. So our main concern is beta cell, which produce insulin. This is also one gland you see. This blue is alpha cell, and this one beta cell. Beta cells are more, and this brown one is delta cell. Now, with this small portion of anatomy in our mind, now we start discussing diabetes mellitus. Diabetes is of 2 types. One is called diabetes mellitus. Another is diabetes insipidus. Insipidus. Diabetes mellitus is produced by the deficiency of insulin hormone. And insipidus, diabetes insipidus is caused by the deficiency of another hormone, this one coming from pituitary gland. So we are now concerned with diabetes mellitus, not insipidus. In insipidus, the kidney cannot absorb most of its fluid. That's why too much fluid goes from the body, exits from the body, and body becomes dehydrated. But here, in diabetes mellitus, it cannot contain, it cannot regulate the glucose. So much glucose comes into the blood, and this is called hyperglycemia. More glucose in the blood. So this is the problem of diabetes mellitus. Diabetes mellitus, due to deficiency of insulin, it cannot regulate the absorption of glucose. That's why too much glucose comes in the blood, and this is called hyperglycemia. And this is the main problem of diabetes mellitus. Now, why diabetes mellitus is caused? I said this is due to deficiency of insulin. Now, this deficiency may be absolute or relative. Absolute means the pancreas itself cannot produce insulin. It is unable to produce insulin because most of the insulin producing cells are atrophied, died. And relative deficiency means there is insulin, but at the same time, tissues are resistant to insulin. That's why insulin cannot work. So also this one will cause diabetes. Either absence of insulin or insulin is there, but it is resistant to the tissues. That's why there will be diabetes for both cause. Now let us see the extent of diabetes in our country. So prevalence of in Bangladesh, prevalence means occurrence of diabetes in Bangladesh, it was 5% population in 2001. And now in 2017, it became 14%, you see, 14%. And in 2021, it is 10.5%. It means 1 person in every 10 person diabetic. If you have a meeting with 100%, you can think that there will be 10% suffering from diabetes out of this your gathering. And they said in future there will be more and more. There is a study I heard before few days. They said 1.5 crores of Bangladeshis are affected with diabetes mellitus. So you can see in homeopathy we treat patient for other complaints. Say patient came to you for treating psoriasis. He came for treating IBS. He came to treat migraine. But at the same time you find he has diabetes as well. And he's taking drugs of diabetes. So how can you deal with this case? It did not come to you to be treated for diabetes. He came for, say, psoriasis, but he has diabetes also, and he's taking tablets for or insulin injection for diabetes. So you have to know how to deal with such complicated case. In India, there was a study also. In India, said there are 100 million Indians has diabetes, and they have more than 10% of adult population having diabetes. Almost, you see, like Bangladesh. Bangladesh has 10.5%. India has 10%. Okay, now there is a classification of diabetes, types of diabetes. We will discuss afterwards. Just we say that type 2 diabetes, there is type 1, there is type 2. I will say what is type 2. Type 2 diabetes incidence is getting more due to greater longevity, because you can say there was 5% people having diabetes in 2001, then 10.5%, more than double in 2021. Why? You can ask the question, why incidence of diabetes is increasing in Bangladesh? So these are the causes. Number one, greater longevity. In Bangladesh, the lifespan of people was 64 years before the government of Awami League last 15 years. I had a study. But in the last, say, few years, maybe 10 years, the longevity has increased to 74 years. It means people are alive for longer time now. Because he's alive for longer time, so diabetes also increases in number. And there is more obesity. Before, people used to work hard. We used to go on foot somewhere, but now we take a rickshaw, we take a tom-tom or CNG to go somewhere. So you are not walking or running. So that's why people having obesity, fatty body. Then unsatisfactory diet. Before, people are taking more raw food, good vegetables and bread and something like this. But nowadays, you know, we take more artificial food, junk food from, say, burger, this and that. So this thing also increases the incidence of diabetes. The sedentary lifestyle. What is sedentary lifestyle? Means the people who works more by sitting. Like us, we homeopathic doctors, we always sit. In the chamber, we sit there and see patient. At home, what we do? We study. How we study? Not by standing, so we sit. So we sit more time. This is called sedentary lifestyle. And increasing urbanization. More people are coming from village to the city. And city life having a bad effect for increasing diabetes. In village, you find less people having diabetes. In city, more having diabetes. So these are the cause of increasing incidence of diabetes in the population. Now let us discuss something about diabetes physiology. What is the mechanism of production of or cause of diabetes in a person? You see, there is a tug of war between production of glucose and utilization of glucose. When we take food, our intestine absorbs the food material, the essence of food materials in the form of glucose, amino acids, something like this. So after we take food, in the blood there is more glucose. And also we have a liver, you know, liver has glycogen. Liver stores glucose in the form of glycogen. So after meal, also liver breaks down glycogen into glucose. So we find after meal we have glucose in the blood from two sources. One is from food itself after absorption in the intestine. Another is liver. Now there are too much glucose in the blood after meal. What happened? This time the body has a stimulation that there is more glucose in the blood. So insulin is secreted from pancreas in more amount. And this insulin, what it does, it sends this glucose into the cell. It is absorbed by the cell, particularly in the muscular tissue, muscle energy in the body. That's why it is produced in the blood. Again, it is consumed in the tissues. So there is a balance in the blood. You find always your blood has a fixed level of glucose. So, for example, 80%, or if I say millimole, say 5 to 7 millimole in the blood always. But if there is deficiency of insulin, then there is no insulin or less insulin, then what will happen? There is production of glucose. There is production of glucose, but there is no utilization of glucose. So excess glucose remains in the blood, and glucose level in the blood rises. So this one produces diabetes. So diabetes has this mechanism. After you take food, glucose comes from the intestine into the blood and also from liver. But insulin, if there is enough insulin, insulin will catch this glucose and send it to the cells to be utilized. And blood will be free of glucose shortly. And there will be a balance in the blood of the level of glucose. But if there is no insulin or less insulin, glucose will not be utilized. That's why glucose will remain in the blood in higher amount. And this will cause diabetes mellitus. Okay? So let us see what are the hormones produced by pancreas. We say that pancreas is a mixed gland, exocrine gland producing digestive enzymes, and endocrine glands, only 1 to 2% of the pancreas, producing a hormone. What hormone? You see, there are 3 hormones we mentioned here. One is insulin, then glucagon, and somatostatin. What is the function of insulin? Insulin will stimulate our cells of the body, particularly the muscles, to utilize more and more glucose. So blood will be having less glucose because insulin is sending the glucose into the muscle cell. The glucagon hormone has the opposite effect. This will discourage the cells to take up glucose. That's why there will be more glucose in the blood. So these 2 hormones work against each other. Insulin reduces the amount of glucose in the blood, and glucagon increases the amount of glucose in the blood. And somatostatin, it prevents release of insulin and glucagon. Okay, we will see only these 2 hormones. Insulin decreases blood glucose and glucagon increases blood glucose. Now I told you exocrine glands of pancreas. Pancreas has 98% gland exocrine, only 1 to 2% endocrine. So what are the functions of this exocrine gland? This exocrine gland of pancreas produce digestive enzymes, the enzymes necessary to digest our food materials. And you know we have food materials 3 types: protein, fat, and carbohydrate. And each type of food is digested a particular type of digestive enzyme. So trypsin and chymotrypsin, these are protease. This enzyme digests proteins. Then carbohydrate is digested by amylase, and fat is digested by lipase. So there are 3 types of enzymes produced by pancreas to digest our food. Proteins by protease, carbohydrate by amylase, and fat by lipase. So these are the functions of exocrine glands of pancreas. Now let us see how blood glucose is regulated in the blood. I already told it. The blood is regulated by a homeostatic mechanism. A balance is maintained between entry of glucose. You know, I told you that after we take food from the intestine, there are more glucose go to blood. And also a portion of glucose comes from liver. And at the same time, glucose is uptaken by peripheral tissues for its work. So there must be a continuous supply of glucose in the body. You must have some glucose always in the blood. What will be the problem? If you don't have glucose in the blood, it means if you don't take any food, what will happen? There will be less glucose in the blood, less glucose. For less glucose, your body tissue will suffer. But the most suffering will be in the brain, because brain has food only glucose. It takes only glucose, no other food, no fat, no protein. That's why when there will be less glucose in the blood, it means when you take less food, your brain will suffer. And if the blood level of glucose decreases to a certain level, your brain will suffer, it will die, and the person will die. You see. That's why you must have glucose always in the blood, but in certain level, in a fixed level, in a fixed range, so that it should not be more, should not be less. And this balance is maintained by insulin and glucagon. Insulin decreases blood glucose and glucagon increases blood glucose. So by its regulation, they have auto-regulation. There is a balance. There is a balance of glucose maintained in the blood. Now let us come. What is the cause of diabetes? Why diabetes occurs? This is called etiology and pathogenesis. And how diabetes is caused in our body. I told you, after some time I will tell you that there are 4 types of diabetes. Okay. Now, in all types of diabetes, there are 2 causes. You can divide the cause into 2. One is called genetic susceptibility. Another is called environmental factors. Environmental factors. So if, say, I don't have, alhamdulillah, I don't have diabetes. But if I have, say for example, I have diabetes, it means I had a genetic susceptibility, genetic from my father and mother and from the family. They may be my father and mother, they had diabetes. So I am born of them. That's why I have a genetic susceptibility in my body to have diabetes in older age. This is called genetic susceptibility, coming from the heredity. Now, to occur a disease, it needs 2 things: genetic susceptibility and environmental cofactors. Say I have genetic susceptibility. My father and mother had diabetes, but I maintain my body very well. I take less food and balanced food, and I do good at exercise, so I will not develop diabetes. You see, that's why you must have genetic susceptibility as well as precipitating environmental factors. Say you take more food and you don't work, you just sleep, and you sit always, and you don't run, don't work, and take good food. Good food means fatty food and rich food like this and that. So your parents had diabetes, and now you are taking more food and less work. So you will develop diabetes. So it needs 2 factors. One is genetic, another is environmental, means your food and your habits and your lifestyle. Okay. Now there is type 1 diabetes and type 2 diabetes. What is type 1 diabetes and what is type 2 diabetes? Type 1 diabetes is where there is damage of insulin producing insulin producing cells in the pancreas. Say, for example, somebody had a viral fever in his childhood. He did not understand. He was not aware that he had viral infection, but he had viral infection. Then that viral infection had an immune effect. And there is this called T lymphocyte. And this immune effect damaged his insulin producing cells. Now, this immune effect is going to damage his insulin producing cells, these beta cells, more and more. Every year there is some damage. Every year there is some damage. Every year there is some damage. Then a stage will come when his body will have less than optimum level of insulin producing cells. So there will be insulin deficiency and he will develop diabetes. So this diabetes is absolute because it is produced due to damage of insulin producing cells in the body. So this is what type 1 diabetes. So type 1 diabetes is produced by damage of insulin producing cells in the body. And it is difficult to treat. If a person has type 1 diabetes, particularly it occurs in children, say a child of 10 years having diabetes, this is your type 1 diabetes. And he will die if he does not take insulin injection. You cannot treat him. There is no treatment. He will die because his body has no insulin producing cells or maybe very minimum insulin producing cells. This is not enough to produce sufficient insulin to maintain his body. So this is type 1 diabetes mellitus. And what is type 2 diabetes mellitus? Type 2 diabetes mellitus is that he has insulin producing cells. He has. And he has enough insulin in the body. But his body is resistant. His body tissue became resistant to the action of insulin. He has insulin, but insulin cannot work. It is resistant. You see? So he will have, this is called relative deficiency of insulin. There is insulin, but it cannot work. It can work half no. So he will develop diabetes, and this is called type 2 diabetes. So type 1 diabetes has no insulin producing cell or very little insulin producing cells. And type 2 diabetes has insulin producing cell, but his insulin is resistant by the tissue of the body. That's why he has type 2 diabetes. If you find a person like me, say I am 68 years old, if I have diabetes, it will be type 2 diabetes. And if a child of 10 years has diabetes, this will be type 1 diabetes. So this is very simple. Again, say I have type 2 diabetes. Okay, now I am 68 years. I am taking some medicine and maintaining myself. But every year, my reserve of insulin producing cells will be less and less. This will be damaged. There will be damage of cells. And there will be a time when there will be not enough insulin producing cells in my body. Then I was type 2 diabetes, now I will become type 1 diabetes. You see? So even type 2 diabetes, after a long time, becomes type 1. And in a child, he is type 1 from beginning. I think you understand now. Type 1 diabetes in a child from beginning. Type 2 in older age like me. And if I have type 2 diabetes for longer time, say I survive another 15 years or 20 years, then my reserve of insulin producing cells will be less and less, and ultimately I will become type 1 again, and I'll have to take insulin. Otherwise I'll die. I hope you understand. So you see, it said that 20% of type 2 patients will ultimately develop profound insulin deficiency requiring insulin and will convert to type 1. So I told you that there is a classification of diabetes. How many types of diabetes? It is 4 types. We already told what is type 1 and what is type 2. Now another type of diabetes, third, this is called secondary diabetes. What is this? Secondary diabetes. Secondary diabetes is that if the insulin producing cells in the pancreas is damaged by some other disease of pancreas itself. Say for example, there is pancreatitis, there is acute pancreatitis, chronic pancreatitis, pancreatic or insulin producing cells become damaged. Or he may have neoplasm, he may have cancer in the pancreas, cancer pancreas. This cancer damaged his insulin producing cells. So this diabetes will be secondary diabetes. Diabetes which occurs due to disease of pancreas itself, inflammatory disease, neoplastic disease, like this. Or it may occur also due to producing excess hormone antagonistic to insulin. There are so many hormones in the body, so many hormones. Say growth hormone, then glucocorticoid, this cortisol hormone, thyroid hormone. So these are antagonistic to the action of insulin. So the growth hormone has a level which will not damage insulin. But if there is more production of growth hormone, how it can occur? It can occur by a disease called acromegaly. There is tumor in the growth hormone producing organ, and there is more growth hormone. So if there are more growth hormone, this will be antagonistic, or this will neutralize the action of insulin. So there will be diabetes. Some person has thyroid hormones, thyrotoxicosis, hyperthyroid. It is producing more and more thyroid hormones. These thyroid hormones again antagonistic to insulin. It will neutralize the action of insulin. So if a person having thyrotoxicosis, hyperthyroid, he will have diabetes. And this is called secondary diabetes. Or a person having allopathic treatment for his asthma, for his, say for example, psoriasis, for his arthritis. He has arthritis. So he's taking more and more steroid by the allopathic doctors. So by taking more steroid by the allopathic doctors or by anybody, so he will have again diabetes. Why? Because these steroid drugs will neutralize the action of insulin. So this sort of diabetes is called secondary diabetes. It is not due to deficiency of insulin. There is insulin, but more hormones are produced from other organs to neutralize the action of insulin. That's why this guy will have diabetes. Now another type of diabetes, it is called gestational diabetes. Gestational, pregnancy diabetes. What is gestational diabetes? You will find some ladies, when they become pregnant, she was not diabetic before, but after pregnancy, she became diabetic. Not after pregnancy, during pregnancy, she became diabetes. Her blood glucose is so high. So why it happens? It happens due to placental hormones. The pregnant lady, she has a placenta inside the uterus. This placenta produces so many types of hormones, and these hormones are antagonistic to the action of insulin. That's why she has insulin. But due to placental hormones, it neutralizes the action of insulin. That's why she has a relative deficiency, and she will produce diabetes. And if it is not treated, then she will have a baby, diabetic baby, very big baby, and ill baby. And maybe the baby will die. That's why she needs treatment during pregnancy. Otherwise, she will have problem. So this diabetes produced during pregnancy due to the bad effects of placental hormones called gestational diabetes or pregnancy diabetes. This diabetes after pregnancy is over will reduce to normal level. But if she becomes pregnant again, maybe she will have again diabetes during pregnancy. And after 2-3 pregnancy diabetes, then this diabetes will not reduce anymore. Then she will have permanent diabetes. So this is called gestational diabetes. So you see diabetes 4 types. Type 1 diabetes having insulin deficiency due to damage of insulin producing cells. Type 2 diabetes, there is insulin, but patient's tissues are resistant to the action of insulin. That's why he became relatively deficient of insulin and becomes diabetic. This is type 2, particularly the older age people. They are type 2 diabetes. And there is secondary diabetes due to pancreatic damage by some diseases or production of other hormones in some other organs which are antagonistic to the action of insulin, or taking of steroid drugs by other doctors, maybe allopathy, maybe anybody, maybe Ayurveda doctor, humanity doctor, they give steroid. Even some bad homeopath, unscrupulous homeopath, they also use steroid. Only few people, they are bad people, they also use steroid. So steroid comes from any source, any doctor. If it is more, then this will produce diabetes in the patient. So this is also secondary diabetes. And gestational diabetes produced during a slowly progressive T-cell mediated autoimmune disease. So type 1 diabetes actually it is an autoimmune disease. I cannot now explain that what is the autoimmune disease. Autoimmune disease means by some inflammation, some infection of virus or bacteria, your body produces some immune cells. These immune cells are produced to combat the virus. But after virus is over, this cell remains and they start attacking the cells of the person himself. So it is said autoimmune disease. These immune cells of the person himself, there is no virus now, but he will now attack the person's important organs and damage. He will damage the important organs like thyroid gland, like pancreas. So type 1 diabetes, it is like this. That the guy has, maybe he had some viral disease in his childhood, or maybe when he is adult, there is a viral disease. He may not be unaware. He did not know that he had viral disease, but it was there. And this will produce some immune cells, immune T cell, we say, lymphocytes. And after the infection is over, this lymphocyte will damage the body cells, cells of the person himself. So here, this will damage the insulin producing cells. So type 1 diabetes occurs in this way. And you see, when he will have diabetes, we said in renal failure, I think who attended my lecture of renal failure, you remember that we had, our body has 2 million nephron, 1 million in each kidney. So 2 million means 20 lakhs nephron. And our body needs only 20% of nephron to keep the body alive. So even if 80% damages, you will not have renal failure. But if you have more than 80%, say 90% cells nephron damaged, then you will have renal failure. It is similar in type 1 diabetes here. A person having less than 70% cells damaged, this insulin producing cell damaged, less than 70%, he will not have diabetes. But if more than 70% cells are damaged, then he will have diabetes, because only 30% cells cannot produce enough insulin to keep him diabetes free. So type 1 diabetes mellitus will not occur by 1 month or something like this. It takes some time. So that his insulin producing beta cells must be damaged more than 70 to 90%. Okay, then he will have diabetes. Now they have genetic predisposition also. This 1/3 of the type 1 diabetic patient had genetic predisposition. It means he had father and mother having such diabetes. So 1/3 of them has genetic hereditary influence to become type 1 diabetes. And also there are some environmental factors to produce type 1 diabetes. What are the factors? See, if a person having some viral infections, mumps, rubella means rubella, German measles, cytomegalovirus infection. If you have that, this, I told you, this autoimmune disease, these immune cells produced in the body will damage your insulin producing cells. So this is environmental factors. And also, if a baby after birth takes cow's milk more, cow's milk, this undiluted cow's milk not good for baby for longer time, because this will give, there is a bovine serum albumin of cow's milk. This triggers type 1 diabetes mellitus. So take care. In your early infancy of your child, don't give cow's milk undiluted for longer time. Then this will produce type 1 diabetes. So these are environmental factors for type 1 diabetes. Some viral infection and consuming undiluted cow's milk for longer time. I have some patient, they are having primary infertility. Some male person, primary infertility. You see, he married and he has good conjugal life. He can make good cohesion with his wife. Everything is all right. But he is infertile. His wife is okay, but he does not have sperm in his semen. Why? So I checked his testes. You see, testes are small and atrophied. So you must examine more and more testes also. Testes penis like this. Otherwise, how can you know what is small and what is normal or big? Many seemingly important patient comes to me that, oh doctor, my penis does not erect well. You see, or he has some cyst. Say he has some epididymal cyst in the testis, something like this. So I always make a good examination. I close the door. I told, remove your clothes. I put on gloves, and I examine. You should have some habit. Then you understand. A patient comes to you with, he will say, I have piles. Maybe he does not have piles. He has fissure or something else. He may have polyps. So how do you know? Because he was not examined by any surgeon. That's why he does not know. He says this is piles. So if you also think that he has piles, no, then you are not a doctor. So you should always examine him. Put him in left lateral position on your bed. You should have a examination table and examine yourself. He's an ass. For putting a gloves on your hand and with a torch. So you can know this is hemorrhoids, piles, or fissure, or maybe polyp or something like this. Similarly, who has erection problem or some problem in the genitalia, you should examine. He will say, I have some discharge from my penis. I had some ulcer in my penis or something like this. He will say, I have some eruption in my scrotum. So you should always try to examine because we are doctors. Otherwise, you will have less information to treat him. So I examined this such guy. I find they have small testes, atrophied testes. I know it. So I asked some of them that did you have any? I have mumps. You know mumps. And these mumps, sometimes there is a complication. It produces orchitis, inflammation in the testes, and these testes become atrophied afterwards. If both testes atrophy, you will never have any children. But he will have a hormone, testosterone hormone. That's why he can have a wife and he can make a coition, no problem. But he will not have any child. Why? You see, this is viral infection. So viral infection can produce this impotency. It can produce thyroid, hypothyroid. It can produce, say, diabetes mellitus. So you should remember this thing in your mind. Okay, then risk of developing type 1 diabetes mellitus in a family with first degree relative. If there is a twin has 35% chance of developing diabetes mellitus. If there is a twin, one has type 1 diabetes mellitus, then the other one has 35% chance of developing type 1 diabetes. Then if your father has type 1 diabetes mellitus, the son will have 9% chance. If mother, 3% chance. If father and mother both have type 1 diabetes mellitus, then son has chance of 30%. So this is all about type 1 diabetes mellitus. I hope most of you understand. But if you don't understand, I tell you to participate in my next lecture in Bengali version, then we will understand more. But you please try to attend in the English lecture as well, so that you must be conversant by hearing English lecture, so that you can also reproduce afterwards. Because if you go anywhere outside Bangladesh, you will not have any lecture given in Bengali. You should have you should be conversant with such lecture. That's why it is better if you understand less, still you attend it. And when you will attend again the Bengali lecture, you will understand everything and maybe better. Now let us discuss about type 2 diabetes mellitus. What is type 2 and how it occurs? So type 2 diabetes is more complex than type 1. Type 1 has only that he has no insulin producing beta cells or less insulin producer. So that's why he has type 1 diabetes. But type 2 is more complicated. But the good thing is that you can treat homeopathically type 2 diabetes. Type 1, no. Those who are type 1 diabetes, fully diagnosed, you cannot help. You cannot cure type 1 diabetes mellitus by homeopathic treatment, I tell you. if a child of 10 years, 12 years having type 1 diabetes mellitus, you have nothing to do with him. But for type 2, we homeopathists have chance to treat and to help them. That's why let us see, let us understand type 2 more. What do we find? The type 2 diabetes, why it occurs, I told you, there is insulin body. So he should not have diabetes, but still he has diabetes. Why? Because his tissue, the muscles tissue or liver and other tissue, these are resistant to the action of insulin. Like, on antibiotic, say somebody has, say, tonsillitis. They give one penicillin. Oh, very nice action. Now, after 6 months, there is again tonsillitis. You will give insulin, you will give penicillin, no, it will not act. Why? Because this bacteria became resistant to the action of antibiotic. It is similarly in type 2 diabetes mellitus. Because his tissue became resistant to the action of insulin. That's why there is insulin, but still he has diabetes, you see. Now, why this resistance occurs? Why this resistance occurs in the body? I tell you. In the beginning, when type 2 diabetes occurs, there is insulin resistance. That's why insulin resistance means all the insulin are not resistant. Say there is 30% of insulin are resistant. 70% still works. So he will not have that. But as the time passes, more and more tissue will become resistant to the insulin. So first 30% tissue insulin was resistant, then 50% tissue resistant, then become 70% resistant, and then there will be diabetes. You understand? So this will occur just from the beginning. The resistance will start, but as the percentage of resistance will be more and more in the tissues, so this pancreas will increase its production of insulin. So there is a resistance, it will produce more and more insulin, but there will be a limit. Then after that, pancreas cannot produce insulin so much. No, he has limit also. So that time he will develop diabetes. If that limit crosses, then he will have diabetes. So type 1 diabetes, type 2 diabetes takes longer time to produce, maybe some years, then it becomes diabetes. But for type 1, it takes only less time because there is a viral infection, it damages the pancreatic cells, and he will develop type 1 diabetes. For type 2, this resistance takes longer time. Okay. Then there is some more thing about diabetes mellitus. Diabetes mellitus 2. This type 2 diabetes is always combined with other diseases, with other bad things. And this will make a person a totally ill person. What? Number one, high blood pressure. Type 2 diabetes, when it occurs in a person, you find that guy will have hypertension as well. And he will be obese, fat person, fat. And he will have more fat in his blood, high cholesterol, high triglyceride. So there will be hyperlipidemia. And all these, blood pressure, obesity, high cholesterol, will predispose him to develop heart disease, to develop stroke, brain stroke. So you will find, or it will be combined with renal failure also. So when you find a type 2 diabetes mellitus, you will have to check for other diseases, that whether he has blood pressure, he has any heart problem, he has any brain problem, what is his cholesterol level, what is his kidney condition, because type 2 diabetes mellitus always combines with type diabetes. So just keep in your mind. Say if I am a person of 68 years, if I have diabetes, you will have to check in me that whether I have high blood pressure, maybe I am fat, maybe I have high cholesterol, I have some heart disease, I have some brain stroke, or something like this. So there is some difference between, you see, type 1 and type 2 diabetes. Now, gestational diabetes, I told you already, that during pregnancy, insulin sensitivity is reduced by placental hormones, and there is diabetes. So let us, okay. Now, how diabetes presents? How a diabetic person will present that he has diabetes, or how he will be detected, how he will be diagnosed that he has diabetes. Many persons, he does not know that he has diabetes. Maybe many of our viewers who are participating in my lecture, you never tested how he test. Maybe many did not test blood sugar. If you are young, it's okay. But if you are more than 40 years old, you should check your blood for diabetes. So first thing you see, a diabetic patient may be found presenting with asymptomatic. He has no symptom. He does not know that he has diabetes. He is normal. He is eating maybe more fat, more sweet, and this and that, and he does not have any interest in playing games or in running or in jogging, in exercising. No, he's a happy man. But suddenly, he was tested for, oh, too much sugar in the urine, too much sugar. Then the doctor will send him for blood sugar test also. Then they will know, oh, there is too much blood sugar. So in this way, he will be detected that he has diabetes. So many of the patients becomes asymptomatic, Lakhon bihin, no symptom. But he was tested for other disease. He came to doctor not for diabetes, for other disease. Then doctor tested his urine, then he find that there is diabetes. That's why we as a doctor, whenever you find a person more than 40 years coming to you for any disease, for psoriasis, for eczema, you should make some common and very ordinary test for him. One CBC, complete blood count, and one urine for RE, and one ultrasonography for whole abdomen. These three tests, I tell you. Maybe patient will think, oh, this doctor is very greedy. He's sending me to laboratory for unnecessary test. No, because you are a GP, a homeopathic doctor is a GP. You treat the whole patient. And you are not aware that he has maybe some undetected disease in him. Maybe he has cancer. Cancer in the blood, he does not know and you don't know. Just you do the test CBC, complete blood count, and cancer will be detected here, you see. He may have thalassemia. He does not know, you don't know. But this CBC will show you, oh, he has only 6 hemoglobin, 7 hemoglobin. Then this will induce you that, okay, send him for hemoglobin electrophoresis. And you find that he has thalassemia. So you send him for urine test, simple urine test, urine for RE. This will help you detecting diabetes, even kidney failure. That's why you do a CBC, you do a urine for RE and an ultrasonography. Why? This, you know, we say in medical side that our abdomen is like a magic box. You don't know what are inside. You know that what are inside, but you don't know their condition. But one whole abdominal ultrasonography will give you a very big idea about the condition of his body. And it will detect some undetected disease in the person. That's why I tell you, I advise you that we are like a GP, general practitioner. Homeopathic doctors are GP. We are not specialists. We are not nephrologists. We are not cardiologists. We are not gastroenterologists. We are not, say, for example, neurologist. So we are GP. We treat everything in the patient, from a small sty in the eye up to one hemorrhoid in the anus, and maybe psoriasis, maybe psychiatric disease, everything. That's why you should check the patient for anything and everything. And when you find a hint in his blood, you do more tests. When you find something in his urine, it will induce you to do more tests. If you find anything in the ultrasonography, then you find, oh my God, he has contracted kidney. You see, so it means he has renal failure. Then you will send him for more tests. That's why the first point is asymptomatic patient. Many patients come to us, no, he does not have anything. He came for something else, but we do this routine test. And this will help us diagnose his undiagnosed disease condition, number one. Second thing, patient will come, maybe he is in severe infection. You know, diabetes. If the person has diabetes and he has severe infection in kidney, severe UTI, he has severe pneumonia, he has severe cholecystitis, he has severe, say for example, pharyngitis, then this will increase his blood level of glucose. So he may have, but due to his infection of the organ, as I said, urinary infection, and you examine him for urinary infection, then you find, oh my God, he has so much blood pressure. So during severe illness, you can find diabetes in the person. Then in some emergency condition, a patient came to you, oh, he's comatose, he's just senseless. Now our homeopathic doctor, what you will do? This is a question in our examination, that if you find a person, he is unconscious, then how can you treat him? But before you treat, you must detect or you must diagnose what he is suffering from. He may have tetanus, he may have a stroke, he may have poisoning, he may have taken something. He may have severe bleeding inside the body and he became shocked. So you must examine it. So in emergency condition, like diabetic ketoacidosis, diabetic coma, so when you examine him for coma, then you can detect diabetes. So these are the unusual cause to find diabetes. But when a person has full-fledged diabetes, you should know his symptoms also. That only by symptoms you know that he has diabetes. So when a person has diabetes for longer time and he did not take any step for diagnosis or treatment, then this one will develop some symptoms. So these are the symptoms of diabetes. What is this? What are these? Number one, this is called, he has polydipsia. What is polydipsia? He has more thirst. He will take water after some time, more and more water, and he will have dry mouth. He will say, like our bryonia cases, he will say, my mouth became dried and I take more water than frequently, or maybe not often. So number one, now it is called polydipsia. Polydipsia means more thirst. Then polyuria. What is polyuria? It means frequency of urination. Every half an hour he goes to urine and he passes too much amount of quantity of urine. This is called polyuria. Noxuria. Noxuria, what is noxuria? He has more urine during night time. He gets up 4 or 5 times from the sleep and go to the urinal and passes large amount of urine. Then he has polyphagia. What is polydipsia, polyuria, polyphagia? What is polyphagia? Or hyperphagia? It means too much hunger. He will be very hungry. Diabetic person will be very hungry. He cannot tolerate hunger. He will take food more and more. Then he will have tiredness, fatigue. By a small or a little work, he will be ill, he will be fatigued, he will be tired. Then he will have recent weight loss. The patient will say, I lost 10 kilo weight by 2 months only. So this is called rapid weight loss or recent weight loss. So if a person says that I lost 10 kilo weight by 2 months, it is said that there are 4 causes. I tell you, a person having rapid weight loss in a small time. Number 1 is diabetes mellitus. Number 2, hyperthyroidism, hyperthyroid. Number 3, cancer. Number 4, nutritional deficiency. So if a person says you that I lost 10 kg weight in 2 months, you must test for his diabetes. Then blurring of vision, he will say, oh, I cannot see well with my eyes. So he may have visual problem or he may have cataract because diabetes will produce cataract. Then pruritus bulbi. If a female has diabetes for longer time, she will have itching in the vulva and vagina. This is called pruritus bulbi. If a female tells you that I always have itching in my vulva, maybe there is no leukorrhea, but there is itching in the vulva. So you think that she may have diabetes. If a person say I have recurrent multiple boils, there are so many boil occurs in my body every now and then. So you must think that he may have diabetes. Then predilection for sweet food. Diabetic patient, they are very fond of taking sweet. If a person takes more and more sweet, you keep in your mind that he may have diabetes. Then there is irritability, mood change, and apathy. This occurs at the later occasion. When he has so much diabetes, he may have irritability, irritable mind, mood change, and apathy to a person. So these are clinical features of a full-fledged diabetic patient. So patient may come to you with more and more thirst. I have more thirst, I have more urine, I have more hunger, and I have weight loss, I have blurring of vision, I have so many boils every now and then, and female will say I have too much itching in the vagina and vulva, and he has mood change and he takes so much sweet. All these are symptoms you keep in your mind that this guy may have diabetes mellitus. Okay, we'll discuss this page only and then we'll finish for today. Okay. This is the how establishing diagnosis of diabetes mellitus. How you confirm that this guy has diabetes. Okay. You suspect that he has weight loss. He has this and that. But you must confirm. So you must know the way of diagnosing diabetes in a patient because you are a doctor. So if there is a question in our examination, then you tell me a single test, very simple and single test by which you can diagnose diabetes. You see? So you remember, a single test, you can diagnose that this guy has diabetes. This is called RBS, random blood sugar. If you suspect a guy he has diabetes, then and then you send him, okay, go and do the test now, RBS, no need of fasting. If he has more than 11 millimole sugar, yes, he is a diabetic patient. You can diagnose him. By millimole, it is 11. By milligram, 200. If he has more than 200 milligram or 11 millimole RBS, random blood sugar, yes, he has diabetes. So this is acid test for diabetes mellitus, you know. But if you find that RBS is elevated but not diagnostic, so it is not 11. We know that diabetes level should be 6 to 7. Now if you find that he has 7, then what you will do? He has 8 RBS. So you cannot decide that whether he has diabetes or not. If he is more than 11, yes, he has diabetes. But it is less than 11, but more than 7 in between. So then he will be in confusion that whether he is diabetes or not. Then what he will do? Yes. Then you will do for him an FBS, fasting blood sugar, or OGTT, oral glucose tolerance test. We say GTT, glucose tolerance test, to confirm that he has diabetes. First, only RBS, okay, right RBS. If it is more than 11, he will come and say, oh, I have 14. Yes, he has diabetes. I have 16 diabetes. I have 12 diabetes. I have 11.5. Yes, you have diabetes. But if it is more than 7 but less than 11, then you are confused. You cannot say he has diabetes, or you cannot say also that he does not have diabetes. Then you will have to go for fasting blood sugar or glucose tolerance test. Okay, how to do this? This is WHO, World Health Organization standard to diagnose diabetes mellitus. This is called OGTT, oral glucose tolerance test. Okay, so you can do two things. You can send him for blood test. At the same time, you also do his urine for urine. Why? Because in the urine there will be glucose and ketone body, ketones. If he has uncontrolled diabetes, you will have glucose and ketones in the urine. And you send him for fasting blood sugar. If fasting blood sugar is more than 7, yes, he has diabetes. RBS we already said. If more than 11, he has diabetes. Now fasting blood sugar, if more than 7, he has diabetes. Now for more confirmatory test, we go for glucose tolerance test. Glucose tolerance test, we just finish. Yes. How to do the glucose tolerance test? There are some conditions to fulfill. Number 1, you will have unrestricted carbohydrate diet for 3 days before test. You tell him you eat anything, so much and so many varieties, no problem. Carbohydrate diet for 3 days. Don't restrict. Number 1. Then he will fast overnight the day before test. So tomorrow he will do the test. This night he will not take food, or he will take food in the evening, and in the morning he will not take food. So he must be without food for at least 8 hours. So he will take light night food, dinner, and in the morning without food he will go for test. Now he cannot have any smoking in this morning, and he will take 30 minutes rest in the examination room. Then they will take his blood sugar. They will take his blood for sugar. Then they will give him 75 gram glucose in say 100 to 200 ml of water. He will take 75 gram glucose. And 2 hours after taking 75 gram glucose, they will test him again. So one in fasting state, another one 2 hours after taking 75 gram glucose. These 2 tests. One is before, one is after. Now, fasting blood sugar, I told you, if it is more than 7, yes, he has diabetes. And after 2 hours of 75 gram glucose, if he has more than 11, yes, he has diabetes. Okay. Now there is another, this is called pre-diabetic or impaired glucose tolerance, IGT. They will say you don't have diabetes, but you are pre-diabetic. What is this? So you know here. if he has fasting blood sugar more than 7.1 but less than 7, means 6 to 7 in between, then he has pre-diabetic, he is pre-diabetic. Or after 2 hours of glucose, 2 hours, if he has 7.8 and less than 11 in between, then this is called pre-diabetic or impaired glucose tolerance, IGT. I think we hope today is too much. Today we'll finish. So you just remember what is OGTT, oral glucose tolerance test, and how to do it. You keep him 3 days fasting, then the last day he will take light food, at night, in the morning no food, and they will take blood sample in the beginning, then they will give him 75-gram glucose to take by mouth. He will wait for 2 hours and then they will take another sample and test. If it is fasting one more than 7 or after 2 hours it is more than 11, yes, he has diabetes, confirmed. But if it is in between, fasting blood sugar 6.1 to 7, then he is pre-diabetic. Or after 2 hours he has 7.8 to 11, he is pre-diabetic. I think this was today. I don't know how many of you attended the lecture, but this is the standard lecture for diabetes, I tell you. And who attended, sure, you will be benefited. And you must know diabetes mellitus. You cannot afford not knowing diabetes. You must know diabetes because many of your patients will have diabetes. And you should know what is this and how to manage it. And what are the tests to do it? What are the conditions which cause diabetes? And how you can prevent diabetes. So you must be conversant with diabetes mellitus. That's why I prepared this lecture for you, for our homeopathic brethren. Thank you very much. Assalamu alaikum wa rahmatullah wa tawfiqi illa billah. Dr. Anwar Patwari, please take the
Alaikum assalam.
and we have still some time. We can take some question and commentary, and you tell them they can ask question in English or in Bengali. I'll answer it. Okay, thank you. Salam alaikum.
Thank you very much, sir, for your excellent class. Dr. Abdul Hannan.
Yes, assalamu alaikum wa rahmatullah, sir. Very good delivery about the diabetic, different types of diabetic. We have discussed in English. I think the Bangla English lecture was very interesting than the Bangla lecture. I think we have discussed about the what type of diabetic and their symptom. You call the asymptomatic, the লক্ষণ ছাড়াই কিছু জিনিস পাওয়া গেছে। Yes, sir. So you are the asset of our homeopathy, sir. I think in the next we will get the great lecture from you and our nation, our homeopath. The world will be very grateful to you, sir. I think may Allah long life you, and I hope you will come again and again with us. Thank you, sir.
Thank you very much for your comments. Okay, if anybody, you can ask question in Bengali also, no problem. Thank you.
আর কারো কোনো প্রশ্ন যদি থাকে অথবা কোনো কমেন্টরি থাকে আপনারা হ্যান্ড রাইজ করলে আমরা নাম ঘোষণা করতে সুবিধা হবে, অথবা কেউ হ্যান্ড রাইজ করতে পারছেন না, আপনি চাইলে সরাসরি মাইক আনমিউট করে আপনার মন্তব্যটা করতে পারেন। মন্তব্য বাংলা অথবা ইংরেজি যে কোনো ভাষায় আপনি করতে পারেন।
আপনি ডায়াবেটিসটা এমন এক অসুখ, আপনার যদি চিকিৎসক নাম লাগে যে আমি চিকিৎসক এবং ডায়াবেটিস জানেন না, আপনি চিকিৎসক না, শিওর। কাজেই ইউ ক্যান নট এফোর্ড নট নোয়িং ডায়াবেটিস, ইউ মাস্ট নো ডায়াবেটিস। কাজেই ডায়াবেটিস সম্বন্ধে বোঝার শেখার, এটা আমাদের এক শেখার ক্লাস। কাজেই আপনি একটা জানেন না, no shame, no problem. আপনার এখানে চান্স আছে, you can discuss and you can know more, or you can know what you did not know before. So আপনি বাংলাতে কোশ্চেন করতে পারেন, নো প্রবলেম, আমরা বাংলাতে আনসার দিব। এবং আমি চাই যে আমাদের ডাক্তাররা এই যে ইম্পর্টেন্ট জিনিসগুলা, যেগুলো আমাদের হোমিওপ্যাথি কলেজের ক্লাসে ডিসকাস করার সুযোগ নাই, বা এখানে হয়তো পড়ানোর মতো এমন কোয়ালিফাইড অনেক টিচারই হয়তো নেই, অথচ এইগুলা কিন্তু ওই যে বললাম ডায়াবেটিস সম্বন্ধে ভালো জানা ছাড়া উপায় নাই, কারণ ডায়াবেটিস রোগী আপনার কাছে আসবেই আসবে। ওকে, থ্যাংক ইউ।
বর্তমানটা আসলে এরকম যে আমাদের কাছে আসলে যেহেতু এগুলো লাইফস্টাইল ডিজিজ এবং অন্য ডিজিজ মানে যেটা বলা হয় যে মানে একটা মানুষের মধ্যে বর্তমান সময়ে এটা মানে কাইন্ড অফ লাইফস্টাইল মহামারী আর কি। এটা এটা থাকবেই, আছেই। চেম্বারে আসলে আমরা যদি 10 জন রোগী দেখি, অন্তত মানে 5 জন রোগীর ডায়াবেটিস, হাই ব্লাড প্রেশার এগুলো থাকেই। এই বিষয়গুলো আমাদের আসলে যথেষ্ট জ্ঞান রাখা মানে অত্যাবশ্যক বলে আমি মনে করি, এবং স্যার যেভাবে যত্ন করে আমাদেরকে যেভাবে পড়াচ্ছেন, এই বিষয়গুলো আমাদের একাডেমিতে ওইভাবে আমাদেরকে দেওয়া হয় না। স্যার প্রায়শই বলে থাকেন যে আমরা উচ্চতর ক্লাস বলছি, এবং আসলেই উচ্চতর লেভেলে যদি এটাকে আমরা ডিসকাস না করি তাহলে আমাদের ক্লাসের মান যেমন থাকে না, আবার আমরাও এই উচ্চতর লেভেলের বোঝাগুলো যদি আমাদের না হয়, পড়া যদি না হয়, আমরা যদি ভালোভাবে বুঝতে না পারি, তাহলে আমরা আমাদের পার্সোনাল প্র্যাকটিসে আসলে সফল হতে পারবো না। এই জন্য আমাদের এই ক্লাসটাকে আরো বেশি তার এই 2টা ভাষাই, বাংলা এবং ইংরেজিতে বোথ ল্যাঙ্গুয়েজে এই ক্লাসটাকে প্রেজেন্ট করে থাকেন। আমাদের হয়তো ইংরেজি অনেকেই সাহস করে বোঝেন না বা বুঝতে চান না, অথবা আসতে ভয় পান। স্যার বলেন যে না, শুনতে শুনতে অভ্যাস হবে, অ্যাটলিস্ট আমরা যদি ক্লাসটা শুনে বুঝতে পারি তাতেও আমাদের যথেষ্ট উপকার হবে। এবং পরবর্তীতে আবার যখন বাংলায় লেকচার দেবে, আজকের ক্লাসে যদি কোনো বিষয় আমাদের কম বোঝা থাকে, আমরা পরবর্তী বাংলা ভার্সনে যখন ক্লাসটা শুনবো তখন আরো বেশি ভালোভাবে বুঝতে পারবো। আর আমাদের আসলে এই বাংলাদেশের বাউন্ডারির বাইরে আমরা যদি যাই, আহ কলকাতা পর্যন্ত হয়তো আমরা আমাদের প্রতিবেশী রাষ্ট্র ভারতে যদি যাই, সেখানে হয়তো বাংলা আমরা কিছুটা পাবো। আর অল ইন্ডিয়া আমরা যে কোনো সেমিনারে যদি অ্যাটেন্ড করি, সেখানে আসলে ইন্টারন্যাশনাল সেমিনার বললেই সেখানে আসলে ইংরেজির কোনো বিকল্প নেই। এই জন্য আমাদেরকে আসলে শুনে বোঝার যে অভ্যাসটা, সেই জায়গাটা অন্তত যদি আমরা অ্যাবজর্ব করতে পারি, আমরা যে কোনো সেমিনারে অ্যাটেন্ড করলে আমরা সেই জায়গা থেকে উপকার পাবো। না হলে আসলে আমি একটা সেমিনারে অ্যাটেন্ড করেছি, আন্তর্জাতিক সেমিনারে অ্যাটেন্ড করেছি, এইটুকু ছাড়া আর আসলে আত্মতৃপ্তি কিছুই থাকবে না, আমরা সেখান থেকে কোনো কিছু নিতে পারবো না। এই জন্য আমাদের এই
নিত্য সাহা একজন আছেন, আর মাহমুদ মাসুমা আক্তার, এরা হ্যান্ড রেজ
নিত্য সাহা হ্যান্ড রেজ করছেন। জি জি, আপনারা আপনাদের নিত্য সাহা আপনার মাইককে আনমিউট করতে।
জি স্যার। স্যার, আমার প্রশ্ন হচ্ছে, হোয়াই কল দ্য ডায়াবেটিস ইজ দ্য মাদার অফ ডিজিজ? হোয়াই কল ডায়াবেটিস ইজ দ্য মাদার অফ ডিজিজ?
I never heard that it is said diabetes is the mother of disease. No. Diabetes, yes, diabetes can produce, or diabetes can lead so many diseases. In our next lectures, you will find, when we will discuss complications of diabetes and the target organs which diabetes attacks and produce many complications, then you will know, you will find the answer. But it is not called mother of all disease, no. I never heard it. But anyway, thank you.
থ্যাংক ইউ। জি, ডক্টর মাসুমা আক্তার, আপনার মাইকটি আনমিউট করে আপনার মন্তব্য অথবা প্রশ্ন।
আসসালামু আলাইকুম স্যার।
ওয়ালাইকুম সালাম।
জি স্যার, আমার একটা প্রশ্ন ছিল যে স্যার, অনেকেই দেখা যাচ্ছে যে অনেক ডাক্তাররা ওই যে সিজিজিএম জেম্বু মাদারটা এক নাগারে খাওয়াই যাচ্ছে রুগীদের, এই সম্পর্কে যদি কিছু বলতেন স্যার।
আমার মনে হয় এটা আমরা যখন আরো 2টা লেকচার